Our next speaker is Dr. Alice Williams.
So I'm Alice Williams. I also want to give a warm thanks to Dr. Daniel Lee and everyone else who worked so hard to put this event together. I always thought it's a really special event for patients with glaucoma to come and learn new things and meet other people who are dealing with glaucoma as well. So I'm going to speak today about monitoring eye pressure at home. This is a really exciting topic because we have some new developments which are improving our ability to monitor eye pressure not only in the office but 24 hours a day. So Daniel Lee did speak about there are many risk factors for glaucoma, and while high eye pressure isn't the whole story, it's a very important factor. So everyone with glaucoma, we know that eye pressure is the one factor we can modify to control the course of the disease. That high eye pressure damages the nerve in the back of the eye, and that's essentially the main issue we're dealing with glaucoma. Everyone here has probably had their pressure measured in the office. The gold standard for measuring eye pressure is called Goldman applanation tonometry. That's the blue light that comes very close to your eye, and I'm sure everyone's familiar with that. And whenever we speak about all these studies that have been done regarding glaucoma, that's how pressure has been measured in those studies. So it's kind of the best way we have to measure pressure, but it's not the only way. There are other means to go about measuring eye pressure. One important factor that not everyone is aware of is that eye pressure fluctuates. It fluctuates throughout the day. It fluctuates from day to day. So just like we have a circadian rhythm that controls our hormones in our body, there are different hormones and other factors that control our eye pressure. And this is true for everyone, even people who don't have glaucoma. But we know that people with glaucoma tend to have more fluctuations in their eye pressure than the general population. And even among patients with glaucoma, those who have more fluctuation tend to have more severe disease and more progressive disease as well. So knowing not only what the eye pressure is, but how much it fluctuates is helpful information to have. So as you can see on this chart here, this is purely a theoretical chart, but it shows how someone's eye pressure, if we were to record it every minute, 24 hours a day, how it might go up and down. And it's important to note that at your doctor's office, we're only getting a snapshot. You are awake and living and breathing for 24 hours a day, 365 days a year. And even if you go to your doctor's office every 3 months, we're only getting, 4 recordings during the year. So even if your pressure is going up and down like this, that little red star might represent what we're seeing at the doctor's office. And if we see you a couple months later, it might look like your pressure is perfectly stable, but in reality, it may be doing something different at home, and we just don't know it. And again, this isn't true for everyone. Some people don't fluctuate so much. But as a physician, where this really comes into play is when we see a patient who seems to be getting worse. Their visual field is getting worse. They feel that their vision is getting worse. But every time we check their pressure, it seems to be right on point. And the suspicion is that one of the causes of that could be that their pressure is higher at home, and we just don't know it. So how can we know what your eye pressure is when you're not at the doctor's office? That's where home eye pressure monitoring comes into play. So this has been an active area of investigation for many years. And very recently, something called the ICARE Home was approved by the FDA for use by patients at home. This is a handheld eye pressure monitor. It's painless. It doesn't require numbing drops. And it's pretty user-friendly. It can automatically tell whether you're measuring the right or the left eye. It can give you indicators to tell you if you're holding the device appropriately and if it's lined up correctly. And you can't see the pressure reading in that instant, but the data is transferred to your doctor's office so that when you come in for your appointment, you can review those measurements with your doctor to get more information. And this is kind of what the device will look like from the patient's perspective. You'll hold it right over your eye like that. And when you're looking at the device, if it's not aligned correctly, you'll see a red light. And when everything's lined up and ready to go, you see a green light, and then you can just press a button and it takes a measurement. Next, I'll show a little video just of what it looks like. If I assume most people here are pretty comfortable with eye stuff, but if it really bothers you, you may not want to look. So this is what the device does. It's a tiny, tiny little probe that just goes forward. And this is, really slowed down, this video. It takes just less than an instant, comes forward, hits the eye, but you don't feel a thing. Does not hurt at all. So as I mentioned, it was FDA approved very recently. It's not able to be purchased by patients. So the way the FDA approved it, it actually has to be purchased, I should say it has to be rented from your doctor's office. So glaucoma specialists are going to buy this device, they will have it in their office, and you'll pay a fee to rent it. Usually you'd rent it for about a week, take some measurements at home a couple times throughout the day, maybe even overnight, just to get some more information. And at this time, I did ask around. I'm not aware of any practices that offer this currently. I know that Wills is actively looking into it, but right now we're just kind of figuring out the details. It is an expensive device. We have to get our technicians trained so that when we rent the device out to patients, patients can learn how to use it appropriately. And there will be a charge, because it's an expensive device, there will be a charge to the patients for that 1 week rental. And unfortunately, that may not be covered by insurance. And I should say it probably won't, unless you have some sort of, health flex spending plan or something like that. There probably will be a nominal charge to use this for a week. So it's a really exciting development, this new ICARE home. Hopefully it'll be available very soon, for people who could benefit from that. And this is still an active area of research as well. People are looking at implanting eye pressure monitors into the eye so that the patient doesn't have to do anything. It'll just sit in your eye and take measurements 24 hours a day. Another area where they've made a lot of advances is actually monitoring eye pressure through contact lenses. And one example of that is shown here. It's called the triggerfish. So it feels just like a normal contact lens, but it has a little sensor on there which can monitor your eye pressure. The problem with this contact lens is that it's kind of not ready for prime time yet. There aren't great studies yet showing how it correlates to the pressure we measure in the office, but that would be an exciting thing that hopefully will be available in the future as well. So thank you very much for having me. Are there any questions at all? Okay.